Several years ago, the Society for Vascular Surgery decided to put together a series of video interviews with leaders and innovators in vascular surgery. And the idea was to have a place where people could look at the history of vascular surgery and at the society fairly easily from the standpoint of people being interviewed. And today we have Dr. Peter Lawrence with us, who was just recently the president of the Society for Vascular Surgery and is a professor at UCLA and is the chief of vascular surgery there. Welcome, Peter.
Thank you.
Where did you grow up, Peter?
I was raised in a relatively small town in southern New Jersey, be considered a suburb of Philadelphia, but it was a historic home called Haddonfield, New Jersey, and we actually lived in a community right outside of there. It's a very rural type of environment when I was raised, on 6 acres, and a house that my father built.
Were your parents physicians, or?
They weren't. They were always very supportive. I think because we had 6 acres and had animals, so we had dogs and cats, but also right after the Second World War, pigs and chickens, and so I think my initial interest when I was a little child was in becoming a veterinarian, but that evolved into medicine. My father, who was supportive of this, was an electrical engineer, worked for a huge company at the time, Radio Corporation of America, RCA, and they had their offices in Camden, New Jersey. My mother stayed at home and raised us, but then eventually owned a store, and my parents evolved into owning a shopping center in southern New Jersey. So I was raised in a relatively rural environment, but close to the urban center.
Did you know you wanted to go into medicine by the time you went to college?
I think probably 3 or 4 times I decided I did, and then didn't want to go into medicine. Probably as my grades slipped in college, I may have decided that other careers have been better, but I started out being pre-med, and actually I just went back recently to a reunion at Dartmouth College where I went, and at both the 40th and 45th reunions I moderated a session about healthcare and medicine. And the reason that that's relevant to this question is because there were 800 men at that time. It was a male-only college, and 450 identified themselves as pre-med. So the first year classes in biology and chemistry were 450 people, gradually weeded out. So it was a very competitive environment, and at about 220 became practicing physicians out of 800
so
in the class.
A quarter of them.
A quarter of the class. But it also meant that we're on a grade system where not everybody got A's like today. So there were a lot of C pluses and B's given out, and I got my share of those.
So the other thing going on in the college scene back in those days was the Vietnam War, and what are your memories of that whole situation?
Well, my memories were very much of a society that I was involved in that evolved. And by that I mean that when I was in college, I would, I think, see myself as sort of a patriotic American who believed in anything the government did was right. And I think the Vietnam War really changed, but it was more than that. It's not that I became unpatriotic, but there were things that I was just not aware of. I think probably the most I ever had in high school was a beer or two. And the issue of drugs at the same time, I had never heard of anybody smoking marijuana or using any sort of drugs. And the drug culture occurred during the mid and late 60s, the sexual revolution, and the Vietnam War, and they all sort of happened at the same time. So college was a time when people had to reassess what their values were. And I would say that I shifted to a certain degree, not dramatically, but I shifted to really beginning to question whether or not the world as I thought it was, which was very comfortable, had changed enough so that I still remember sort of agonizing over, was it right to be in Vietnam, and gradually evolved as my parents did, who were very conservative when I was raised up, to really questioning whether the Vietnam War was the best thing to do. So as a society, and for many people, that evolution was from a very structured and optimistic world to one where you began to question a lot of the values, of which the Vietnam War, as you asked, was one of them. And I was in the group where there was a draft, but it was based on a lottery system. And fortunately, I got into medical school before the lottery was implemented, but afterward, I still got my lottery assignment, and it was number 321. And there are 365 days in the year, so I wouldn't have been drafted even if I had not gone to medical school. But I went to medical school rather than serving in Vietnam.
We all know our draft numbers.
You remember yours?
326.
Oh, so you were even, so.
13.
13.
Yeah, 13.
And then you went to medical school.
Correct, yeah.
Yeah. But I remember that time was real. People waited and figured out whether they really believed in the war, and if they didn't, then they figured out a way to get out with a health issue and flat feet, and I can remember all the discussions. But it was also, questioning whether or not this is the right thing for America to do, and even whether the leadership of America was giving honest assessments of why we were there and whether we should stay there.
Now, it sounds like you and your dad were pretty close, and you repaired boats, and you built a moth. Tell me about that experience, and did that influence your interest in surgery?
I'm sure it did. I wasn't aware of it at the time, but my life consisted when I was growing up. My father was very smart, not the best people person, although he's a wonderfully loving father, but he wasn't a social type of person, which my mother was. But he was an engineer and had about 60 patents. He developed the landing system for the first landing on the moon, and had a group of about 400 engineers that he oversaw. And I never realized all this until he died, and he had actually written his own obituary of what he had done during his life. And I never was aware of that. What I was aware of was that every night when I would come home, the question was, are you done with your homework? And if I say yes, then I would go down in the basement with him, and we would do woodworking, build boats. We built them from scratch, literally having the lumber cut at the lumber yard and ripped, and and then steaming and bending the wood. So I really had a parent who did things from, as he called it, we do these things from scratch. In addition to that, the home on 6 acres that I was raised in was about 3,000 square feet. And he put in every nail on that house. It's still a beautiful house today. So his real passion was in structural and building things, even though he's an electrical engineer. And so I considered that what you did every night was you went down, and every weekend you went down, and so we built boats, and we refinished boats, and we restored boats, and we just did a lot of woodworking together.
Then you did sailing, and then you won a national championship at second place.
Yeah, I've got some interesting stories, maybe for me more than for others, but I was both raced, one designed boats, and also taught sailing. And I was growing up, so every year, and I was playing a lot of sports, particularly football, where they wanted you to be as big as you could. So every year I was a little bit heavier, sometimes a lot heavier. Not with fat, but just with getting stronger. So, for example, a couple that I raced in lasers and moths and Flying Dutchman, and I think I was considered it, and at the time I was a very good sailor. But each year I'd have to figure out whether or not I got too heavy for that boat. And one year I can remember I was in the National Laser Championship, and was in the lead, and there were like 200 boats, so it was this huge regatta. And I borrowed a boat from a friend, and I was probably a little bit heavier than I should. So in heavy wind, I did great. But the wind died down a little bit, and somebody on port and starboard came. We came together I was literally in the lead, and I told this guy, I was on port, he was on starboard, and I was crossing it. I said, hold your course, and he held his course, and he went right into the transom of the boat and put this big hole in my laser. And that's the last competitive race that I did on it. Yeah. So I sort of limped home. I couldn't keep sailing in the race, but sailing was really great, and it was really, in those small boats, was a great sport. but your body weight was a key factor in some of these 11, 15 to 20-foot boats.
Was that event what made you become a defensive end in football?
I think that my experience in life was with the sports was if you played more than one sport, that the coach at the time, one wanted you to gain weight, the other one wanted you to lose weight, the other one wanted you to be stronger, and so sailing was not something that a football coach was supportive of.
I always wondered how you got interested in lasers.
Yeah, you mean the medical laser.
Then off to Harvard Medical School.
Yeah, well, I actually went for 2 years to Dartmouth Medical School. And I would be honest, I'd have to honestly admit that I was not the best student, and I'm not sure. I always think that there is a Lawrence someplace who says, I don't understand why I didn't get into medical school, because I had the best record, and this other Lawrence got in. But for whatever reason, I got into medical school, and I really became a much more serious student. And I think a little was based on the athletics that I had done, and sort of people figuring that as an athlete, if you spend all of your time on medicine, because you split your time between different activities, that you could become a pretty good doctor. And so my sense is that that was how I got into medical school. So I went for 2 years to Dartmouth Medical School, which was a continuum, but virtually everybody at Dartmouth, I think we had 52 in our class, and 48 or 49 of the 52 went to Harvard. That was a very standard approach, so I ended up going to Harvard after Dartmouth.
Now, you haven't talked about his 70-yard run back on an interception. We talked about this last evening, so tell me about that play and what that meant.
Well, it was my senior year. I was a really good junior player in my junior year in college, and the senior year is always the year when you get awards and you win the championship, so the seniors really see that as an important year. About the third game, we were playing against Princeton, and I rolled my ankle and had an unstable ankle for about 2 or 3 more games, and so I would try to play and I couldn't. I tried to play against Harvard and couldn't do that, but I'd say each time, and I think that our ability to diagnose things like the high ankle sprains were not there at the time. They'd sort of shake your ankle and say, looks good to me, and you'd be out on the field. So a couple times I tried to play in games and just couldn't. I had no mobility. Finally, I got back to playing. In the game against Cornell, I was a defensive end, and they wrote with the way our defense played, when the quarterback rolled the opposite way in certain defenses, the defensive end, which I was at the time, dropped off into the back and covered the back side. And a very good quarterback, who I think actually ended up playing in the NFL, threw a pass across field, and I think he thought I was still suffering from a sprained ankle. So I intercepted it and ran the length of the field, or at least I ran from about the 30-yard line on our side so it was about a 70-yard touchdown play, and got me some notoriety.
Definitely a highlight of the.
It was just a great event. But we didn't, because the Ivy League teams, even though there were some great players there, and several of the people I played against, and we were very competitive with all these teams, ended up playing in the NFL. So there were good core of players, but there wasn't the depth. And we had 3 or 4 players that got injured, including myself, and we didn't have the championship year that we anticipated, and that's always hard in your senior year. But fortunately for me, I had other options there, and over my career, we had virtually every year had a championship, but it's hard your last year to not achieve what you thought you should.
How did you decide to apply for a surgical residency?
Well, when I was a medical student at Harvard, the culture was that if you were smart, you went into medicine, internal medicine, and sort of surgery was for the carpenters, and
Which you were.
Yes, I said, well, that's exactly me. So I think that over time, so I started being interested in medicine, but every rotation I did in surgery, I found that it was the most rewarding, and there were admirable people who at each one. So I rotated through Brigham and Women's, which at that time was called Peter Bent Brigham, and Franny Moore was the chief of surgery. Very inspiring, and the vascular team there. at Mass General, the surgeons were just great. They were excellent, they were smart, they were excellent teachers, and they were excellent surgeons, and they intervened with patients in a way that at the time, medicine had none of the minimally invasive. They didn't do endoscopy and things that they do now. So I realized that my passion and my interest was in doing surgical things, and I had this background of woodworking and building and using my hands, so I thought this was a great combination, and it turned out to be the case.
So you ended up at Columbia in general surgery training, and what are your memories of that? There were some very prominent vascular surgeons there at the time.
There were, and my decision to go to Columbia was one that I debated. My wife was a graduate student in academics, and I actually thought about staying in Boston and interviewed at all the programs, and I think I had done pretty well in medical school, and so you can sort of tell in the Harvard system who's going to get selected for different residencies, and I think I could have stayed there, and my advisor actually, whom I won't mention because he told me, he said, if there are only 4 programs in America that are worth training at, and one of them was Mass General, and the other was Brigham, I think Hopkins, Duke, and maybe one other place. He said, and if you can't get into one of those, it's probably not worth being a surgeon. And so I always thought that was, so I said, but I may be going to Columbia Presbyterian. He said, why would you go there? And I said, well, it's one of the great programs, and my wife is a graduate student, and she's gotten into Columbia, and Harvard wouldn't tell us, there was the match at that time, and she didn't know whether she would get a position as a graduate student. So I ended up going to Columbia because I thought it was a great program, but also to match 2 careers. And it had an incredible tradition to it. The people that were there went back generations. So Alan O. Whipple had been there, and Blake Moore, who was one of the early vascular surgeons. But even among the vascular group, there was Arthur B. Voorhees, who was the chief of vascular. There's a guy named Ferdinand McAllister, who's a very good surgeon. There were just a number, Joe Buda, Mark Hardy, a number of very prominent people at the time, but led by Art Voorhees. And so I got to know him pretty well. I had actually in medical school at Harvard had each time that it was like fate that I had been assigned for my surgical clerkship in a general surgery service to a vascular service. It happened to me twice, once for my 3rd year rotation, once for my 4th. So by the time I had finished my 4th year of medical school, I had been on vascular services at Brigham and Women. It was Chilton Crane was and I think Donaldson. There were several people who did a lot of vascular surgery there. So by the time I got to Columbia, I had a pretty good idea that I thought that vascular was an exciting area. And I ran into people who at Columbia were equally inspiring, including the chief of surgery, Keith Reemsma, who was a cardiac surgeon but also did vascular. And he became a mentor like Voorhees did for me. And I got to know them well personally as well as professionally.
Well, tell us more about Art Voorhees, because he is one of the people that developed prosthetic grafts and probably put in the first prosthetic graft.
He did, and it's interesting because we came from a similar background, and I probably knew him as well as anybody, although the other person he was very fond of was, at the time that I was there, was Andy Whittemore. But I probably knew him as well as most, if not all, people who were in training, and yet I still didn't know him well. And the reason I say that is because he was very reserved, very distinguished, quiet. He came from a Quaker family, and his family was from southern New Jersey, which is where I was from. In fact, I think it was his wife's family who owned a large hotel in Atlantic City when that used to be a very glamorous place to go in the summer, and it eventually became one of the casinos. But he had a family from New Jersey, and so because of that background and my interest in vascular, I got to know him pretty well personally. He used to house sit every time he would go on a vacation. He had a home in Arizona. He wanted to have somebody in his house. So it was, I think Andy Whittemore preceded me, and I think somebody else before that was house sitting, but I did it for like a year or two. So I knew every book that he read, what he had on the coffee table. And he was just he was a quiet and a non-self-aggrandizing person. He you'd have to say, Dr. Voorhees, tell me about the Vignon N and how you developed that. Because if you didn't ask him, he would just quietly do the cases. If you'd ask him, he was very open. And I'm sure, the people sitting here, Dr. Yao probably know him as a friend. I don't know if you ever had any any relationship, but he never got the opportunity or never became a leader in national societies, I think just because he was so quiet.
He's quite a person. I had coffee with him at one time. We have a nice talk about his discovery and everything. He's a wonderful person.
As I remember it, there was a time when he was looking for research opportunities, and I think another person who just recently died, who was a great teacher at Columbia, Alfred Jaretsky. I think it was Voorhees, Jaretsky, and maybe Blakemore were on the first surgical forum paper, and he realized that there was a lot of excess parachute material. At least this is what he told me after the Second World War, and he knew somebody in a company who had made the parachutes for the Second World War. So they had a lot of surplus back there. And my understanding was that he went to that person and said, we're trying to make these things, and originally had sheets and cut them and sewed them together. Another vascular surgeon at Columbia named Shivaji Bonsley, we used to call him Baba Bonsley. That was his nickname, was Baba. And he would sew these grafts in both the animal and also in the operating room. And they would put these grafts into patients by measuring the diameter of the proximal aorta and the iliacs, and then he'd call out, or maybe Bonsley came into the room and he'd say, I need a bifurcation graft, or I need a tube graft of this diameter and with this side branch, and then they go out and sew it on a sewing machine, and they would put it in the autoclave, and then 20 minutes later that would be the graft that was put in the patient. So it's a pretty amazing era when you think about how innovative, and of course I don't think there were IRBs at the time, so they didn't worry about approval. If they thought this was in the best interest of the patient, then they did it. And the other thing I remember about Art Voorhees was him telling me he was interested in aneurysms, about putting wire into aneurysms, and he put this, through a femoral approach, and I guess they actually did a cut down, then they didn't do it percutaneously, and then eventually used the needle to do it, but having this very flexible copper wire and just sort of forcing it up the iliac until it got into the aorta and coiling it enough so it thrombosed the aneurysm, which they thought reduced the risk of rupture. And so that's what preceded the Vignon N. So it was an era that was fascinating, but it also wasn't that many years before we finished our training.
Well, how did a surgeon meet an English professor?
My wife,
grad student, right.
Yeah.
Tell us the story about how you met your wife.
Well, I was an undergraduate at Dartmouth, and my wife Karen went to Smith College. And in those days, Smith was all women's and Dartmouth was all men. So in my junior year of college, one of my friends said, there's a mixer at Smith. Do you want to go? And it was driving down Route 91, and we went down as a group. I think we were, like one dormitory would invite one house or one part of the college. It wasn't like everybody mixed. And you walk in the door and you're looking around and trying to find somebody that's a friendly face, and you're a little nervous and they're a little nervous. Somehow we just started talking, and we had a good time, but you're only there for an hour or two. It's not like, and in those days there were what they called parietals, which means that it's like at the end of the night there's no possibility except you get in the car and drive home, and they go back to their dorm and they lock the door. So there was no possibility, not that there would have been anyway, but because I barely knew her, but I talked to her then. And then interestingly, I have still a close friend who had an apartment in New York City. And he asked me if I wanted to come and stay with him in his apartment. And he was going to throw it with a friend of his. And I got to the party, and his friend was not my wife, but it was a friend of my wife, and she had been invited not knowing. And so I walk in the door at this party, and there's the person I had talked to. So we then talked again and started dating, and
so the coincidence of the second meeting.
Had there not been a second party, the likelihood is that we wouldn't have continued to date. And then she transferred from Smith College to Yale, which was a killer for me because it was a wonderful college, but it was our competitor in sports, and I hated people from Yale. And then she told me she's going to go to Yale, but the reason she went was because they had a great English department there, probably the world's best at the time, and she finished her graduate studies finished her undergraduate and then went on to get a graduate degree.
You both have had spectacular careers. You've had 2 children, and you've been married how long?
Over 40 years. If she were here, she would tell you the exact, I think it's 41 or 42 years.
Well, maybe for younger surgeons, you could give some advice on the life-work balance. How have you done that?
It's an interesting and I think everybody has a different way of making their personal lives match their professional. And for us, we've had different phases in our life. But the most important thing is you find somebody that it doesn't make any difference what everybody in the rest of the world thinks, that you find you enjoy seeing and is interesting. Obviously, you have to have a passion to get married, but also it's got to be more than that, and somebody that you enjoy talking to and being with in all situations. And if you have somebody that is like that, it's a very special thing. And then also somebody that grows, because we're East Coast people who thought that anything west of the Hudson River was the rest of the world, and we ended up eventually moving to Utah and California. And you've got to grow together, and I think for us, we've been very fortunate in our personal lives. We have made time for each other. We lived in places that allowed us to do that, and our highest priorities have always been our personal relationship, our kids, and our job, and then other things can come after that.
And so Karen went on to become a real world expert on Irish literature, and then also administration of higher education.
Right. It's interesting because I think somebody is a wonderful person, a nice person, a talented person, but I don't think any of us know how our spouses are going to be perceived by the outside world. I knew she was a special person, and I knew she was smart, and she had gotten into great colleges, but over her career, when we moved to new places, what I realized was that, first of all, she was doing pretty innovative work. She worked in her field of research was modern British literature, but particularly an interest in James Joyce. She did a lot in women's studies as well, and wrote several of the definitive books on James Joyce that are still used today in teaching people how to read Joyce and how to read Ulysses. So, but in addition to that, when we got to the University of Utah, I realized that she was getting appointed to committees and asked to be the acting chair, and things that indicated that people had tremendous respect for her. And she moved very quickly in Utah administratively as well as academically. Part of it, they go together. So she got elected to be the president of the International James Joyce Foundation, and did that for 2 terms, which is all of the Joyce scholars in the world. And then she did it in narrative literature too. She became the head of that society, for president of that for 1 term. So as our careers evolved in Utah, she was getting higher and higher administrative levels. So I knew that she would eventually be offered positions at other places, and she was offered both to stay at Utah and move to the provost position, which is the second in command at the University of Utah, but she was also offered the opportunity to move to UC Irvine as the dean at Irvine, and she did that for I think 9 years almost. She had 2 5-year appointments, and a year before the end of that, she had accomplished enough there as a dean, I assume, is why she started being looked at by many colleges, and as the college president. And part of that was that UC Irvine at the time was and had excellent humanities, and had a couple philosophers, one of whom is a French philosopher named Jacques Derrida. And most people in medicine don't know the name Derrida, but they do know the term deconstruction. And he was the father and the founder of the term deconstruction. We talk about it all the time. It's often a pejorative for people on the right and it's positive for people on the left. But the idea of deconstructing things came from Jacques Derrida. And so she had some exceptional people there, and I think the recognition of the humanities at Irvine, which is one of the very top places in America, led to her interviewing and looking at several jobs. And we always said, you know, we're going to only do a job where we can both move to it. Our kids were now at the point where they were going to college, and so we wanted, and I realized that she was going to be offered jobs at places that it would be very hard for me to continue with my academic career. And yet I wanted something that would match her professional goals. And I always thought that if she turned these down repeatedly, at some point she wouldn't be offered to look anymore, but also she'd always have in her own mind, could I have been a successful president of a college? So when the college that she's at now, Sarah Lawrence, came along, and she had interviewed at several other places and got to be a finalist, and you know, a couple times just the location wasn't correct or whatever. I realized that it was more important to let her pursue her dream than it was to say, you know, we got to stay together. So and yet I looked at some opportunities in New York, which is Sarah Lawrence is right outside of New York City, and realized that if I moved, that I might hurt my career because there really wasn't the opportunity for me that I had at that time at UCLA. So we agreed that she would take the job and try it for a while, and we'd see how things go. And it's 9 years later, and she's near the end of her second 5-year term, and will probably, I don't know how it'll work out, but she'll probably retire or step down at the end of next year.
Now, at the University of Utah, you became interested in surgical education, and I sort of caught back when we were talking about teaching sailing that you were a teacher at an early age. Tell us about that interest. You have numerous publications in education, sort of the foundational book, The Essentials of Surgery and Essentials of Subspecialty Surgery. And just tell us about that part of your life and how you got involved in surgical education.
Well, I think it was, as you said, it came because I taught sailing, and you had a group of young and middle and young and maybe not so young children that you were teaching how to sail in groups of 30, 40, 50, and had to figure out, it was on-the-job training as to how you teach people to sail a sailboat. And I think I learned that and evolved and became pretty good at it in sailing, but that's a lot different from medicine. And then, you know, I was at a college in Dartmouth and Dartmouth Medical School and Harvard, that all of which they focused on education and really were committed to. So I had some great mentors, and I think that's part of it. And then at Columbia, both Keith Reemsma, then the program director was a guy named Tom King. And Tom King had come from Utah, as Reemsma had, to Columbia, and they were both great, great educators. And they really were committed, but they also taught you about education and educational psychology, how adults learn, how they learn differently from children, and all of this was ingrained in the Columbia residents. So, and I would just admire greatly Tom King, and so that's where I picked up my interest. And then I got to the University of Utah, and as happens at many surgery programs, the youngest person who comes in, the chief of surgery calls them up and says, at the time Frank Moody, and said, "You're the clerkship director." And I said, "Dr. Moody, I don't know anything about it." He said, "Well, it's about time you found out about it." So after a year or two, I got a letter. I think in those times email was not used routinely. I got a letter from Bruce Gewirtz. He was at Southwestern at the time, and he had been assigned to education there. And so he said, "We're going to have a meeting of people who are clerkship directors to help people figure out how to run clerkships." And he anticipated, I'm sure, 5 or 10 people showing up. And there were like 150 people that came to this meeting, because everybody who had been assigned to be a clerkship director and sort of struggling came together. And I had the fortunate experience of sitting next to, at a table, so there are 150 people in round tables, and I sat next to a guy I had never met. We just sat down, everybody sat down. And during the process, he was from Southwestern, a guy named Royce Laycock, And he was elected president. He had no idea, somebody had to become the president. Well, he was sitting next to me at lunch, so he said, I want you, because he knew my name, probably knew a few, I want you to be the head of the curriculum committee. And so, just by chance, by sitting next to Royce Laycock, and so we did a lot of innovative things, figuring out what students needed to know, writing a textbook which was focused totally on students, and it, I think, became sort of the classic textbook for most students on education, and surgical education particularly. And we just signed a contract for the 6th edition, and it's used by about 2/3 of the medical students and medical schools as their primary textbook now.
You're certainly a leader in that society, the Surgical Education Society, and you've made it grow. And I think you met Deb DeRosa along the way.
That's correct.
You guys worked considerably together.
I'm not as involved now in the ASC because it's really a young people, still clerkship directors are mainly young faculty. So, you've got to pass on a society to the next generation. So even though I'm very supportive of it, and it's a great society, I don't go as regularly. I go occasionally to meetings, but not as regularly. But did meet great educators like Deb DeRosa, who I know was at your institution, and I met her when she was at Southern Illinois. Very unusual, committed, dedicated educators. And then I got interested in surgical technique, and particularly open surgery, because I could see the number of open cases going down as endovascular became the mode of therapy for up to 80% of patients in some areas like aneurysms. So we could see the open cases going down. And my background and interest in education, I tried to translate into simulators and how you teach surgeons open surgery in an era where there are many fewer operations being done. So that's been an interest of mine most recently.
Yeah, one of your papers is teaching in the OR, so I can sort of picture you teaching kids sailing, like pull this rope, pull that rope. Tell us about teaching in the OR. It seems like that's a pretty good place to do some teaching.
Well, the challenge, of course, is that you've got a patient there, and surgeons always feel that their highest priority is the patient. So it's how you have a student get integrated into the experience in the operating room. And as I think we're 4 surgeons sitting here, as all of us know, that it's somebody who's inspired you in the operating room, or you think is a great surgeon or a great teacher, who is often what led to your becoming a surgeon. And so it was how you can maintain quality in your patient care and yet teach students, and a lot of it is just a personal commitment. But it's it's like all education. It's two-way street, and if the educator is interested and the students just blow by and aren't interested, that's not going to work. But also, if the students are intensely interested in the person who's the teacher, the faculty member, it doesn't care about students and it really focuses on the patient, then they'll have a boring, bad experience. So it was about how students should prepare for the operating room, the things that are high priority for surgeons that they care about. So showing up on time is just a simple thing. That some of the anatomy, that you've reviewed it before, and that some of the common procedures. And if a student prepares for an experience, I think they're often included more in the operation, which is what inspires them to go into surgery.
Reflect on your experience in Utah. That was your first major job, and
yeah, I think you and I met probably after I had been at my job, and I know you're a little younger than me, but it wasn't too many years after that. And Utah I went there primarily because my wife and I both had job offers at the University of Utah. Each of us could have stayed. I could have stayed in the New York area. There's several academic jobs. For her, for English professors with an interest in modern British literature, I think there were like 5 jobs in all of America. And of those 5, probably 3 were places, that were where we couldn't even work because there wasn't a major hospital. So there were only 2 or 3 jobs available, and one of them happened to be at the University of Utah, where my mentors from Columbia, Keith Reamsman and Tom King, had both been before they came to Columbia. So they arranged everything for an interview. Frank Moody was the chair of the Department of Surgery. And I went out there in that era as both a general and a vascular surgeon. I had done a vascular Res Fellowship, one of the unapproved because they didn't have approved at that time. And I felt I was a good general surgeon and a good vascular surgeon, and so I started out doing all surgery and running the clerkship and working probably about 60% of my time at the VA. And over the time, as vascular became an independent specialty, I got increasingly involved in doing exclusively vascular, setting up a vascular lab. We went up to Mass General and looked at their lab and then set one up at Columbia, and I took that experience to Utah and set up an independent vascular lab, which they had never had before, and just gradually built a vascular surgery service at both the VA hospital and at the University of Utah. And I was there for 20 years.
You hired a couple of young faculty members that we know well. Spencer Gauld and Larry Krause were people that we were actually recruiting at Northwestern at exactly the same time, if you remember. And then we thought, well, Peter's going to hire one of them.
Yeah.
And then both of them are so great that we'll hire the other one. And then they both ended up going to work for you, Peter.
Yeah, well, that was a very interesting. We had one job. And you know, when you got interview all the people that come in or over the phone, you didn't have everybody travel in. And I realized that there were two exceptional people. And I remember getting letters about how good Spencer was. And equally, Alec Clues called me and said, you know, if you hire this guy, Larry Krause, you will not make a mistake. He is a real superstar.
Yeah.
And both of them had a basic research interest. And at about that time, the University of Utah got some grant money from a very committed, thoughtful family in Utah to develop what they called CVRTI, Cardiovascular Research and Training Institute. And essentially what it was a conversion for people interested in basic research from fellowship, they called it F to F, fellow to faculty. And they brought people in cardiovascular research from all over the University of Utah together, and they supported them. And they didn't support all their salary, and I started thinking, if I could get them committed to Larry and Spencer, probably the best thing for their career would be if we didn't hire one or the other, but if we could get both of them because they become friends and colleagues. Mm-hmm. We had a job at the VA, and they could share the job, so they'd be 50% clinical and 50% basic research, and the funding of the basic research could be helped by CVRTI. So I realized that probably the best thing to jump and improve our basic research was to hire two of them who did become very close best friends, and they collaborated on a lot of research, and they both started out with outstanding research careers because of that collaboration.
You've been involved with, besides being president of the SVS, many other surgical society presidencies. Tell us about the surgical leadership and the importance of that.
Well, part of it is just getting, if you're old enough, you get opportunities to do things. But I think that that over time that I've been involved in societies, I'm engaged enough that for whatever reason, people have selected me or asked me to become the president. But it's always been preceded by a lot of work in the society. And my sense is the reason that's happened with, 7 or 8 societies is because of certain things that I learned when I was younger, and particularly playing sports and football and lacrosse, which are the 2 college sports that I played, is, there's a lot of individual rewards and accolades, but they only come to you when you have a winning team. If you're a 3-8 football team, you're not going to be many people are going to make the all-league team or the all-American team. And so you really need to think about team first. And so I think that my ability to participate as a team player and not have to be the star of the team, ironically, is what leads to you getting in a leadership position, because, everything that you do for other people is far more rewarded by society than what you do if you're a self-promoter. And so in each of the societies, like the Association for Surgical Education, the ASC, I did a lot with the curriculum committee, and we just as a group got together and wrote the curriculum and ended up publishing a textbook. And that led to me becoming the president of the ASC. But it was because we worked as a team and we were able to work. And I think it's something that probably some surgeons are good at, but some of them are not, because it is a system that can allow an individual to be a star and see themselves as at the top of a pyramid. And, you know, I always think of myself as being one of the team, and that may be why I've gotten selected to some of these positions.
Tell us about your year as the president of the SVS and the most interesting parts of it, and about your presidential address, which was very, stimulating and had a lot of new concepts to many of the people in the audience.
Sure. Well, first of all, it was probably the greatest professional honor. But being the president of the SVS, as several of you here know since you've done this, it's a 3 or 4 year job. And you sort of learn because you are the vice president and the president-elect and the president. And then for many now, you go on to become the head of the SVS Foundation. So you learn the process and you learn what the SVS is all about from the inside. And for me, it was just an immense honor to do it. But I think that probably the best decision I made was when I was nominated and then elected to be the vice president. I went to the chair of our department, who was a former SVS member, Ron Busatil. And Ron's now one of the world's, if not the world's most prominent transplant surgeon. He's one of the top 3 or 4. But he started out in vascular surgery. And in fact, people still refer to some of the papers on graft infection and some of the work that Busatil did. And I said, Ron, that I'm going to do this. I think it's a really important thing for me personally, and I think it's something that I can do well. But I can't do it well and also be the division chief and be a really busy clinical surgeon. I have to change something. And I had talked to a couple of the immediate past presidents who were friends, Peter Glavitsky and Rich Cambrian, and said, how much of your time and what did you do? Well, for some of them, they just added the president's job onto an 80-hour week or an 100-hour week, and they worked on weekends and stuff. And I felt that and so the best decision I made is I said to Ron, you may want to have me replaced as a division chief because I'm going to do this job. And he said, well, we don't want you to do. What would it take? And I said, for me to do this job well, I need to work for the SVS on Mondays and Fridays. So I'm going to only work 3 days a week. And if you want me to step out, and he said, I don't want you to step down. So I actually did that. And except for very rare situations, I spent all Friday, made a call to our executive director, Becky Marin, and on Mondays we often had a call of the president-elect, the vice president, myself, and Becky, and I really spent the time and put the effort in to the SVS. And some of the initiatives at the time were making the SVS more international, because there were a lot of societies around the world that were running into similar issues as the SVS, both good and bad, but they wanted colleagues. And so in those couple of years, each year did well over $200,000 worth of travel and went to Brazil and South America, other places in South America, Asia 2 or 3 times, Europe, and then throughout the United States, and tried to think of the SVS as being an expanding specialty of a truly international. We didn't want to force the SVS on other cultures and other societies. At the same time, if they wanted us to be involved, we would. So I spent a lot of time in travel and focused on broadening the appeal based on both age, gender, and making the process of being a member of the SVS being much more involved in the management of it. So committees, RFPs for everything. Now, not all of this was done by me. It was done over many, many past presidents, but I really put an effort into broadening it and focusing on vascular surgery becoming a specialty of vascular disease management and trying to focus on that.
Tell us about your presidential address.
Well, one of the great, I think, opportunities, but also challenges, and you know about it 3 years before you need to give it, and or get the opportunity to give it, is you need to think about something that's important to you. It's not simply a paper on, like I gave today a talk at the Northwestern meeting on femoral aneurysms. Those become, there's a methodology to that. But for the presidential address, you get to talk for anywhere between 50 and 60 minutes to the vascular surgery world, or at least the American vascular surgery world, about a topic that's really important to you. And so I knew it was coming up. And for the Crawford Symposium, which the president-elect moderates, we talked about appropriateness. And part of the reason for that was because I could see the field of vascular surgery evolving into vascular disease management, but then it began to include vascular medicine, risk factor modification, but also endovascular and minimally invasive approaches that other specialties also felt that they either were involved with or wanted to get involved with: interventional radiology, interventional cardiology. So the appropriateness issue arose because there were concerns expressed while I was coming through the presidential evolution of positions about whether not only were vascular surgeons, but were other specialties doing things in the best interest of patients. As our ability to treat more and more diseases with more and more technology and minimally invasive technology, whether we were overusing that technology. So we had the Crawford Symposium, and I thought that we had Mike Dake talk from a interventional radiology perspective, and we had several people. Bob Zwolak talked about the changes in volume in certain areas and whether they were appropriate or not, and whether they were. So it was a real collaborative, multidisciplinary discussion of that. And I thought that was sort of the end of it. So for the first 6 years of my 1 year being president, I was working on my presidential address, and it was going to be about change and how change occurs for an individual like me or you or any of us over our lifetime, how a field of knowledge changes, and how, especially in medicine, needs to change to become, to keep its leadership role in whatever disease they're involved with. So it was going to be all about change. And I had read a lot about it in Harvard Business School as to how companies change, and publications that are outside of medicine. And I probably had the talk like half completed and knew what I was going to say for the whole talk. When in January, I believe it was in January, there's this article that came out in the New York Times about this doctor who was doing what were perceived by the reporters in the New York Times to be doing inappropriate procedures in high volume on patients. And I think he had billed or collected something in the $16 to $18 million range in 1 year. And what I had not anticipated, I thought people would be upset and read this article, was I think when we added them all up, we got 1,000 responses. SVS members, they sent things to me personally, they sent them to the office here of the SVS. There was a group that started discussing this, and I was always included in it, but it was leading to different people who were talking about ethics and all this. And I realized that my talk on change was sort of real theoretical, and I think could have been a good talk. But what really people cared about was how was ethics and what we did as physicians, and how the vascular world had changed. And we had the ability to do things a lot better, which is the reason I titled it Better, because it was a takeoff on Atul Gawande, who had written a book called Better. But then I put as, but not always in vascular disease management, because we were seeing patients who had vascular diseases that were being treated when they really didn't need treatment. And it wasn't all other specialties. It wasn't like it was cardiology or interventional. There were vascular surgeons as well. And part of it was perceived by many people when they sent me all these emails to be due to the ambulatory procedure centers where there were no quality controls like a hospital. In a hospital you have a medical staff office and tells you whether you get privileges, and then your quality is measured to some degree, whereas in the office-based a psychiatrist could decide to treat arterial or venous disease in an office and get reimbursed the same amount as a vascular surgeon. So I realized that this was a very, very important issue by the number of emails, and so I redirected my change talk to talk about the title was Better, but Not Always in Vascular Disease Management. And it was about not only the magnitude of the problem of both appropriate but particularly inappropriate care, but with about 10 suggestions as to ways that we could curb or reduce the amount of inappropriate or unnecessary procedures. And I didn't realize at the time when I started how much had already been written on inappropriate. There was a Dartmouth Atlas which looked at variation. There were several ethicists and surgeons who had written a lot about this and what they called unnecessary surgery. There was even a USA Today long article by 2 investigative reporters on people who were getting inappropriate surgery, and it wasn't just vascular. This was hysterectomies and other procedures. So it became a great opportunity for me and to talk about something that was about change, but it was about making things better and why they weren't and how we could address these issues to really make it truly better. And it's in press and it'll be out in the Journal of Vascular Surgery, I think, this next month.
No, it was a very thought-provoking speech, I can say that.
Well, you've had a super successful career, Peter, but along the way there should have been some bumps along the way. So I want to know how you dealt with adversity or failure. How did you deal with that? I'm sure in your football career, and how did you deal with it?
Well, I do think that from sports that you learn and that the highs are never quite as high and the lows are never quite as low, because it can turn around and you can have lost 10 games and then you upset the league champion and all of a sudden the season seems better, but you can also be undefeated like the New England Patriots were, and all of a sudden are they going to lose 3 in a row? So things can change very quickly in sports, and I think from that you learn, first of all, how important it is to prepare and to really be ready. Whether you're a surgeon going into the operating room or you're going out on a football or lacrosse field, you have to really believe in yourself and that you're as well prepared as you can possibly be. And then the other thing that I think I learned from my college experience was that if you really believe that that's the case and you go all out and you play as hard as you can, there's always opportunities to be a little bit better, but if you feel like you've done your best, it's much easier to walk away from that experience, even if you lose, than it is if you don't feel like you really put the effort in. So if you go out drinking the night before, or you don't get in shape in the summer, or whatever it is, it doesn't allow you to prepare. So I think that for me, having that background was very helpful. And there have been some, like everybody, some bumps in the road. As I said, I wasn't a great college student. I think I was reasonably bright and I got into a good college, but I didn't really apply myself like I should in college. And I feel like somebody was like an angel over me, that when I applied to medical school, it decided, in spite of my, it wasn't I had a horrible record, but my mediocre record, that I would be a good medical student and end up being a good. So that was sort of when I was applying to medical school. I realized that I hadn't done the preparation that I knew that I needed to do in athletics. I hadn't done it in medicine, but I still was fortunate. But I would say probably one of the toughest things was when I was at the University of Utah, and I had a couple leadership opportunities, including being the chief of surgery at the Veterans Hospital. Did that after I'd been there for 3 or 4 years, and did it for almost 10 years. But about halfway through that experience, I was up for promotion to professor. So I'd moved pretty quickly through the system. They had a vote, and the chief of surgery at the time, Bill Gay, called me in and he said, "I just want to let you know that the faculty has voted against your promotion to professor." And I thought, boy, my CV's pretty strong. I mean, I thought I had done the right things. And he said, "There are a bunch of people at the VA who opposed you because you have not been supportive of their specialty." And what I realized was I was sort of a purist, and what was happening was at the VA that there were some divisions that weren't always using their time at the VA, that when they would have a patient needing like a neurosurgical procedure, that if they had a patient at the university, since they worked at both, sometimes they canceled the VA patient and go over and they didn't do the operation, and that patient would just get it delayed for a week or two. But it would waste OR time, and I talked to them several times about it, and I said, you're going to lose your OR time if you don't keep, if you keep canceling cases. And finally, I did take away their OR time, and that led to well, I just didn't handle that politically as well as I should. I should have gone to Bill Gay. I should have gotten his support. I should have met with him a few more times. I didn't get promoted to professor the first time I came up for it. The next year, I think I had patched things up and talked to him and them about it, and I guess we reestablished some of their OR time. For whatever reason, I got through that. But that was when you think you're on a career path and you're doing well, then I think it's particularly hard to have something like that happen. And then I would say the other greatest challenge, although it's also been an incredible opportunity, has been when my wife and I decided when I would stay at UCLA and on the West Coast and she would move. That to me is probably the greatest challenge, is to maintain that, not that it's hard to maintain a relationship because we have a great one, but to keep things going on two coasts simultaneously. And I think that, again, my sense is that things are never as bad as they seem or as great as they seem, and you have to really have a perspective that every time I think about that I have to get on a plane and go to Bronxville, New York through JFK from Los Angeles, then I think, I've got a couple friends who died prematurely of a heart attack or prostate cancer or colon cancer or something that were in my college and my class. I've had some friends who were in the military and assigned for 6 months and then stayed in the military and were away from their family for a year or two. In the big picture, what I have is I'm pretty fortunate. So I think that having a perspective, an optimistic view, and also understanding that you really have to believe that you've done everything you can and be willing to correct things, but if you believe you're properly prepared and well trained, then you can walk away from, whether it's an athletic event or an experience with a patient, and you have a horrible complication or a death on the table, and you weren't prepared, I think you feel very badly and very guilty. I'll just tell you, if it's okay, one more story of when I was at the University of Utah, a lady was referred to me with mesenteric ischemia, and it was clear that something had dramatically changed. She had acute mesenteric ischemia, and so she needed to have something done. She couldn't be referred someplace else, and what she had was a chronically occluded SMA and a high-grade, a chronically occluded celiac and a high-grade SMA stenosis, and she had severe abdominal pain, but she didn't have dead bowels. So anyway, we decided we were going to fix her, and I called, I think it was Ron Stoney or Jerry Goldstone at the time, somebody at UCSF, because they did a trapdoor endarterectomy. And so anyway, I ended up preparing as well as I thought I could, and for the case, did the case, did an endarterectomy, used the Doppler to make sure that we had flow in the SMA, closed the trapdoor. She did great. We had a summer vacation, and we always went with a group of friends camping in Utah. So I got on the road with our family, all packed up with our SUV, and we're driving south. We're about 4 hours south, and this is when cell phones, you still had reception, but they were the big boxy cell phone. And I'm driving south, and I get a call, and somebody says, Mrs. So-and-so does not look good. She's hypotensive, and we're going through this. I said, well, good. So we worked up, and essentially what happened was that she died of a thrombosed superior mesenteric artery. I still don't know exactly why, but it obviously thrombosed from something I'd done technically. And I was on the road, and I was thinking about 2 hours later, I stopped again and called the team back, and they said she's looking worse. She's in the ICU. She's hypotensive, but she's alive. Would you like to talk to her husband? And so I called her husband, talked to him, and then I'm going another hour. And so now we're like 6 hours out of Salt Lake City, near St. George, where we're going to this camping trip. My kids are all singing and happy. And I said to my wife, I said, I really think I should turn around and go back. I just operated on this lady 2 years ago. I don't know if she's going to make it. I don't think she's going to make it, but she's going to die, and I'm on a vacation. And I haven't talked to her, I haven't talked to her. So if you can imagine being on an interstate with your kids and saying, I'm turning around after 6 hours and going back to Salt Lake City, and they start shouting at me and screaming, why would you do this? You're gonna, you know, somebody else can take care of it. So I ended up going back, and she died. And I really, and I didn't have any regrets, but I really thought it was a teaching experience for me, because I learned, I think I did the right thing at the time. It was so painful for our family. They missed their vacation with all their friends. But I really realized that sometimes in the short term, you do the right thing. In other words, it wasn't that I naturally had the instinct to turn around and come back, but I really thought that for the last 20 years, even though she died, had I kept going and been on that camping trip when she died, I probably for the rest of my life I would have regretted that decision. And I think my kids learned something about it, because they learned that you do what's right. So anyway, a long story, but it was at least for our family, it was
Very good story.
It was a very interesting
important
experience.
story, yeah.
I mean, you could have heard them shouting at me.
I can imagine.
Why would you turn around? Our friends are waiting for us, you know, and we're all said, you know, it's hard for me to explain why, but I do think it's important. Maybe sometime in your life you'll understand.
You mentioned about Keith Reemsma.
Yeah.
You know, he done a lot of work for the Vascular Society. It has been said that he is the Hawkeye or the Mass movie. Is that true? You have any?
No, I think that they may have put, you know, together several personalities. There was a person who was the chief of surgery at the University of Vermont, who was a Hawkeye. Or I think Keith Reemsma was some part of it, but I don't think he was exactly the character. But he was an exceptional person. He was also a very modest. Between Art Voorhees and Keith Reemsma, I only was aware of how talented and how well regarded they were when I left.
Guy.
He's a great guy, a funny guy, and he was just very entertaining, but a very nice person, but pretty modest. And so I didn't really know how talented and exceptional he was until I got to Utah, and then people started talking about Dr. Reemsma. And
I was told you are a very good tight end in your career. Tell us something about your football career.
Sure. Well, it's obviously a long career compressed into a few sentences, but I was a very committed athlete, but not a particularly good athlete as a little kid. In fact, I can still remember the coach calling my father aside and saying that I need to learn how to run because I was so slow. So I was sort of waddling as a football, and he was worried that if I didn't get faster, when I went to high school, I started growing, and as you can see, I'm 6'4", so I was growing, but I was pretty skinny, and I played football, I played basketball, I played tennis, and so I did a lot of sports. But I would say I didn't really excel. And about my junior year, first of all, it must have paid off the running because I got faster. Pretty soon I became the fastest guy on our high school team, and then actually on the college team, I think I was the fastest in our college team, and pretty big at the time because I got up to about 240 of not like today, but muscle, and I was a pretty sculpted athlete at the time, and so my athletic career I was a late bloomer, I would say. My junior year, there was nobody in college interested. My senior year, nobody interested, and then our team went undefeated, and I started winning some awards, and then coaches from different places. In those days, it wasn't the science like it is today. So like Joe Paterno, who had recruited at our high school, and that wasn't at all interested in me. And then my senior year, started calling up the coaches, would he be interested in coming to Penn State? And so I ended up starting with a small college. My grandfather had gone to Amherst College, and I got into Amherst. And then several of the Ivy League schools that were Princeton and then Harvard, Yale, but at the time, the real powerhouse was Dartmouth, and I had some connections there because my dad had recruited there. So I end up going to Dartmouth. And by the time I got there, then I was another 20 pounds heavier. So then, as time went on in college, I sort of grew into a body, and I was fast, and I was probably bigger than the average end. Now I started out in offense and defense, but in those days you could only play one or the other. So when it went to platoon system, I actually was solely defense. And as I mentioned, I got these ankle injuries my senior year, so that limited that year. But I did have interest from, and actually was contacted and was going to be drafted by the Dallas Cowboys or the Denver Broncos, both of those teams, because I was then 240 and I was fast, and that they were looking to convert me from a defensive end to a linebacker. I played in a rugby tournament with some friends, and I ended up getting the worst. I've still got this huge scar. I got a dislocation, separation in my arm or my shoulder, and that combined with getting into medical school was the best decision. Because I'm now walking. I can walk in. I think I don't have too much dementia, but a lot of those players from that era, I've known them as friends, and I know many of them end up with major disabilities from their athletic injuries. Because remember, in that era, there wasn't arthroscopic repair of ACLs. It was an open operation. When you had an injury, you got your ankle fixed with surgery. You got your knee fixed, your hip. So there are a lot of big operations. And I've seen, of the group that I was with at the time, the Ivy League was pretty strong as far as the sort of the top tier of players. And Calvin Hill I played against, who then, he was the first person taken by the Dallas Cowboys and ended up having an all-pro career there, and a guy named Marty Domres who played and was a quarterback in the NFL, and I was thinking there was a guy from UMass who we played a lot against. Anyway, there were about 10 players who played in the NFL, but today many of those people are limping or walking in or have had 2 or 3 knee replacements, and the injuries were, and what I realized was that had I stayed in sports, first I don't know that I could have been a professional athlete or even not been cut from the team, but if I had made it, you make it with the understanding that you're going to have lifelong injuries from the athletics. And so I'm pretty fortunate that I got an alternative career which has allowed me to walk around. And
Peter, tell us a bit about your family.
Well, I have a wife, Karen, who has been an exceptional friend and partner. We've been married for, I should know this exactly, but about 45 years. Not only did we have not very nice academic careers, but we have 2 great kids. There were 2 boys that were born in Utah, and they're now both in their early 30s. They're about 22 months apart. Our oldest son, Andy, went to college where I did at Dartmouth, and probably mainly because of that connection, because he was a West Coast son living in California, but was interested in going east and looked at a number of places, but decided and got the opportunity to go to Dartmouth. And he was a humanities major when he was in college, finished and Comp Lit was his field. And following that, he did not go to graduate school. He started working and thought he was going to go to graduate school, and he's become he's successful in a management position, and he currently works with a company called Ralph Lauren of Asia, which is part of the Ralph Lauren family of companies. And he has moved from Hong Kong to Taiwan and is now working and living in Seoul, South Korea. And he's a vice president for operations for all of the Ralph Lauren stores in Seoul, South Korea.
Sounds like a big job.
It is. It's for a young guy, it's been a great opportunity. I think probably one that would have only come about by being in Asia, and because if you're in the United States, there are many more people in a company, and so he's got that. When he was in Hong Kong, he met his wife Jessica, and they got married about 1.5 years ago. And so, fortunately, she's been able to move to different locations with him. although it's very hard to get a job, to get a work permit to actually have a job. So she hasn't been working as he's moved to these new jobs. But they're very happily married, and so that's the older son. The younger son is Jeff, and Jeff is 22 months younger than Andy. Both of our boys grew up in Salt Lake City and in an environment where I think we asked them to be serious students, but there's also a lot of athletics involved, and both of our boys were good in 3 sports, in soccer, in tennis, and in basketball. And Andy chose the basketball route and became a very good high school basketball player, although he didn't play in college. And Jeff chose the tennis route. And that's relevant because when he finished high school, rather than going immediately to college, he decided to take a year off and do 2 things. Played a little bit on the pro tour, and there's 3 tiers of professional tennis, and he played in 1 tier and was a very good tennis player. But I think in that year decided that he didn't want to do that for a career. But also he learned Spanish and became very fluent in Spanish, and went to Mexico and lived there for about 3 months so he could become conversant in Spanish. And that led to, when he went to college, becoming a major in Spanish literature and Spanish. And he took that to the next level and went to graduate school at Princeton University, where he was in the comparative literature program there, wrote his dissertation, translates Spanish literature into English, and is now gotten a job, and he's an assistant professor in the English department at Rutgers University, the state university. And he teaches both Spanish literature, but he also does American literature. So it's really literature of the Americas is what his specialty is. So I think they're 2 very special children, and probably come from a special wife as much as anything for me.
It sounds like.
Yes, so it's
Exactly.
it's an exceptional and a
I was
great
gonna say
family,
that,
and I sort of sometimes kick myself. I'm honored to be in the family, although I produced a part of it, obviously.
Peter, one of the most important developments in vascular research is the foundation. And tell us about the foundation.
Well, the foundation is a responsibility of the past president of the SVS, and for 1 year we're responsible for not only fundraising but overseeing the functions of the foundation. And it's really the research support for both clinical and basic research. And it's a foundation that has been successful. I think that we can and should have a larger endowment because we could fund more research. But it's a place that many vascular surgeons start their research careers because, as you know, when you're applying to any other funding agency, NIH or Department of Defense or the VA, you often have to have some early data. And so the SVS Foundation is a method for getting started. So we fund clinical research, we fund basic research, we fund travel for people to look at different institutions that might be able to help them get their research started. And overall, I think it's a key to vascular surgeons maintaining and keeping a leadership role in not only vascular research, but the management of vascular disease. And so it's a very important part of the past president's job, and we've made a real effort to try to increase the total endowment within the foundation by getting contributions from everybody who benefits from it, from past presidents of the SVS to the board to chairs of committees and councils. For example, the History Project, you're the chair of that committee.
Yes.
So you get a letter from me pointing out how important it is and probably how much of a positive impact the SVS had on your career in trying to get people how much they're capable of, but passing down some money and building the foundation so others can have the same research opportunities that we did. I know you and I started out doing, for example, laser research a number of years ago, and I could have never funded that research on my own. So
Exactly.
each of us has benefited in different ways. Either that was some basic research, but also there's important clinical and outcomes research that's funded by the foundation.
One of the real bases of vascular surgery is the Journal of Vascular Surgery, and that the editorship of that turns over periodically, and you soon will be taking the reins of that with Peter Glavitsky. Tell us what your thoughts are. I'll bet you've thought about it pretty intensely in the last few months and have some great ideas for us.
Well, it's interesting that when you think about different phases of your life, and this is something that Peter and I have been friends for a number of years, as we sort of wind down our clinical and our administrative careers at each of our medical centers, you think about what you would like to do and what you think you'd be good at. And we got together as a team, which is the way that the editors of the JVS are selected. And the journal puts out a call for proposals, and there are usually 4 to 5 teams that come in with 2 people, because there are there's a senior and an editor-in-chief, and you put together a proposal. And he and I talked quite a bit about what we thought we could do to build upon the JVS. Now, as you probably know, and I'm sure you know because you have written a lot for it, that the JVS was started and founded by Michael DeBakey, and it's gone through about 6 groups of editors over a period of about 50 years. And so it's been around for a while, and yet it's a relatively young journal. It's the highest journal as far as impact factor that focuses on vascular surgery and endovascular, which is great for a small specialty like vascular surgery, and it's become increasingly international. At least 50% of the submissions are from outside of the United States. So our plans are to do a couple things, and they manifest themselves in things that you see visibly, like all of the covers of the JVS are going to be coordinated, because we realized that our predecessors, the last group of editors, did an incredible job of developing the JVS, and Tony Sadawe and Bruce Perler had those positions that will hold, and they got a venous journal developed, and now it's cited, and all the papers are listed on PubMed, which is not an easy thing to do. It takes a while of accumulating statistics, so that journal is important. And then the third journal that was developed is one called Case Reports, which is an online open access journal, and we've actually are adding a name to it, so it's called Case Reports and Innovative Techniques, because we find a lot of, rather than case reports, submissions for a technique which is new, hasn't really been fully tested, but seems to be innovative and new, that we'd like to make people aware of. So now there are actually 3 journals in the family of the Journal of Vascular Surgery: the JVS, which will be straight arterial; the JVS VL and venous and lymphatic, which will be on the blue journal and will be venous; and then an online case reports and innovative techniques. And we also plan to align with each of those journals a different editorial board, rather than having one like there is now for both journals. This was planned by Tony, but now we can implement it. Tony and Bruce had thought that eventually this would happen, but we're going to have a separate editorial board and editors for the Journal of Vascular Surgery, the arterial, and a separate group of editors and reviewers for the JVS VL, and then both will work with the case reports. And then we're going to try to do a few other things. We're going to try to enhance not only the number, but the way that review articles are published. We're going to try to make them rather than just a straight review article, we call them systematic reviews, and there's going to be more information about the process of doing the review and the validity of the review data and references. We plan to emphasize certain things which we think are important to vascular surgeons, that not only increase the impact of the journal, but that might be of interest internationally, and also to get more societies to use the JVS as their primary journal. So these are all improvements, we think, and modifications, but they build on an incredible journal that's been very successful. But we think, our responsibility is to take it a little bit of a level higher, and we hope that the people who follow us in 3 to 6 years, we'll do the same thing. So it's an evolutionary process for a great journal, and we've been very honored to be selected to do that for at least 3 years. And then if we do a good job, you get reappointed, it'll be for another 3, so a total of 6. And we're hoping that people like yourself, now we were talking about this earlier, but someone like yourself who's had a long-standing interest in intermittent claudication and medical therapy, written about it, have colleagues in other fields, but have done some research that we can entice people to write these systematic review articles, which really will define, and be such high quality reviews of things like your interest in intermittent claudication and the medical therapy for it, that they'll be quoted not only by people who read the JVS, but through virtually anyone who takes care of vascular disease.
Finally, I want to ask you the famous question: what would you tell young surgeons when they start their career?
I would say I've become less of a recruiter now and more of an advisor. And I would say to them that whatever you start out doing, that the key, and it's the key whether you're in business or in healthcare, a surgeon, is pick something you have a passion for. Because we put in a tremendous amount of time and effort into to be successful in any career. I've known people, went to college like all of us here at exceptional colleges where people went in multiple directions. And the one component that makes them successful is whatever they do, that they have a passion for it. If they're going through the motions. So if I think you can inspire people to be interested in surgery, but if you're talking them into it rather than them having the passion, it's not going to work out. So number one is preparation. Get the best possible training. And even if it takes another year or two, if you want to do basic research, go into a lab that really trains you. Don't do it part-time, do it well. Get very well trained, but pick some area where you have a passion. And if you do that, what's the expression that you never work a day in your life? And I must say that my year at the SVS, people say, boy, wasn't that a lot of work? And you do. And I never had for a minute anything but a sense that this was the greatest honor, and I had the greatest time doing the presidency, vice presidency, president-elect, because I really had a passion for it. And that's sort of what I've tried to live by, but that would be my advice for young people is don't go into what your father wants you to do or your mother wants you to do or what's the most prestigious thing. Anything you pick, if you have passion, you can run environmental services and a trash collecting business, and if that's your passion, you can do a great job with it. Don't worry so much about the prestige and worry about what you really enjoy doing.
I think that's very important. I just got the email, the Journal of Vascular Surgery accept the paper on advice to young surgeons.
Oh, good.
I'm going to include your statement.
Oh, great. And I didn't review it. No, we'll put that for the record.
And thank
Now, there's
you.
certain editors, see, I didn't see that paper, but somebody, I don't know who.
I just got it in an email.
Oh, good, great.
So I will include
Yeah.
what you said about passion.
Don't you think that's the
very
key?
important.
You look at professional athletes. When they're going through the motion, they don't play well. When you care about it, when you're LeBron James and
When you're in
four
the
of you-
playoffs.
you're in the playoff and 4 of your friends, the colleagues are injured, the thing that sustained him, that almost, they didn't quite, but they almost beat a great, great team, was his passion for winning. And, if he maintains that, Cleveland will win it. And if he loses it, they won't.
So we are going to include the passions
Yeah.
into that. Thank you for coming.
Thanks. Thanks for the honor of being interviewed and including me in this great series.
Thank you, Peter.